What's up everyone? Welcome back to my YouTube channel. Today we're discussing enlarged prostates and my 5 best tips to help you manage an enlarged prostate, also called BPH. Now, these tips are going to help you relieve some of the symptoms and discomfort that come along with this condition. If you're new here, my name is Eric and I'm a men's health physiotherapist. And this channel is dedicated to men's health physiotherapy and helping you to overcome men's health issues. So please subscribe to my channel by clicking the subscribe button below and join our growing community. I'll be uploading a new video every single week, so you don't want to miss out. And if you enjoy my content, please feel free to hit the like button. It really helps my channel grow and reach more men that might need help too. Tip number 1 involves alcohol and caffeine. Let's start with alcohol. Now, who doesn't enjoy a night out or a drink with dinner? Casually drinking alcohol, in my opinion, isn't the problem. It's consuming too much alcohol in one sitting that is going to make your enlarged prostate symptoms worse. When you drink alcohol, it can cause your bladder neck to constrict, which can make urinating difficult and result in difficulty emptying your bladder completely. Alcohol is also inflammatory in nature, meaning that it's going to increase inflammation within your body. And it has the potential to worsen the inflammation naturally occurring within your prostate cells. Drinking too much alcohol can also impact the muscles in your bladder as well as your pelvic floor, because having one too many drinks prevents the relaxation of your bladder, resulting in needing to use the bathroom constantly.
I have to go to the bathroom!
Whereas with the pelvic floor muscles, and these are the muscles that support the bladder, too much alcohol during a night out causes these muscles to fatigue and weaken, meaning it's much harder to hold your bladder and you'll probably end up with some urine leakage or even a lot of urine leakage by the end of the night. So you can see how drinking too much alcohol can make your enlarged prostate symptoms much worse. On the other hand, consuming too much caffeine can also cause you to urinate frequently, which will increase your enlarged prostate symptoms. This is because caffeine is what's called a diuretic, which essentially means you're going to have to pee more frequently after consuming it. And to finish off tip number 1, when you're experiencing a flare-up in your enlarged prostate symptoms, do your best to limit the amount of coffee, teas, sodas, or even fizzy drink, which all contain a lot of caffeine. The second tip I have for you is to stop eating sugar. Now, this can be a really triggering topic as not many people enjoy talking about their diet and their weight. However, there is way too much research out there that suggests a direct link between sugar and enlarged prostate issues, so I'd be doing you a disservice by not talking about it. And trust me, I have just as bad of a sweet tooth as the next person, and I can completely understand that reducing your sugar intake can be quite difficult. However, studies suggest that men with high blood sugar, meaning they consume too many sweets, are at the greatest risk of developing an enlarged prostate and making their symptoms worse. This is because sugar, especially processed sugar, causes an inflammatory effect on prostate cells, meaning it increases the prostate's growth, worsening your symptoms. And on top of the inflammatory response, too much sugar causes the release of insulin, and this is called hyperinsulinemia. Insulin acts as a growth hormone, and it's insulin that typically causes your prostate to grow after many years of eating way too much sugar. The bottom line with this tip is just to try your hardest to either limit or completely cut out your sugar, and this includes processed sugar in junk food and soft drinks. It's common for a lot of us to think that our diets are healthy, when in fact you might be consuming too much of something that's actually making your prostate issues worse. Check for yourself and keep a diary of every single thing you eat and drink over 1 week. And this will help to give you your answer. The sooner you reflect on your eating and drinking habits, the sooner you can take small steps to making positive changes. Tip number 3 is to complete the correct types of exercise. Now, this tip doesn't have as much research to support it. However, I'm going to explain how exercising more can help you better manage your enlarged prostate symptoms. Now, there was a study conducted in 2021 which looked at the impact aerobic exercise had on enlarged prostates in mice. This study found that completing more aerobic exercise led to the mice losing body fat. And when the mice lost body fat, this also resulted in their enlarged prostates actually shrinking. And lastly, this study found that aerobic exercise actually slowed down the hormones that cause the prostate to grow in the first place. The takeaway here is that participating in more aerobic exercise, such as hiking, swimming, walking, will help you to lose weight. Imagine how much body fat you could lose by combining aerobic exercise and stopping your consumption of sugar. This weight loss could also help you naturally shrink your enlarged prostate, decreasing the number of symptoms you experience. Now, the ACSM guidelines state that men should be completing around 150 minutes of moderate to intense aerobic exercise every week. And if we break this into 30-minute exercise sessions completed 5 days per week, this will get you to that 150-minute benchmark, helping you to decrease the amount of symptoms you experience with your enlarged prostate. Tip number 4 is to reduce the amount of fluids you consume at nighttime. When you're consuming fluids at night before bed, such as water or tea, you are drastically increasing the chances of you waking several times during the night to use the bathroom. This extra fluid is also going to worsen some of your enlarged prostate issues, such as having an increased urge to urinate, an increased frequency in going to the bathroom, which only worsens your ability to fully empty your bladder. My best advice is to stop drinking all fluids after dinner, and for most, this will be anytime between 5:30 and 7:30 at night. Now, if you take medications at night, you can still drink water, but only use a tiny amount. If you can stop drinking water, tea, or any other fluids before bed, you will notice a massive decrease in the amount of symptoms you experience at night, as well as a decrease in the number of times you're waking up to use the bathroom, which will give you a much more restful sleep. My 5th and final tip in managing your enlarged prostate symptoms is trying bladder retraining exercises. Bladder retraining exercises will help you decrease the amount of dribble you experience after going to the bathroom. And they will also help you to hold your bladder for longer and prevent any leakage in urine. Bladder retraining involves urge suppression when you get the feeling of needing to urinate, as well as reducing the amount of fluids you consume. This urge suppression will help you to delay going to the bathroom so that you can overcome any abnormal urinating schedules. I suggest you try to complete a few Kegel contractions, also known as pelvic floor squeezes, on the spot, and this will help you suppress the urge to urinate. Now, it's important to note that in the beginning, you should only try to hold your bladder and suppress this urge for around 1 minute, and then go straight to the bathroom. As you get better and better with suppressing this urge and holding your bladder, you can slowly increase the amount of time you delay for. Try to work up to 5 minutes over the span of a couple weeks. The goal is to retrain your bladder using these strategies to avoid constantly having to go pee. Alright, so this video only covers a select few tips to naturally help you manage your enlarged prostate symptoms. Yes, there are so many other strategies out there. However, the 5 tips I covered in this video should help you start making improvements with your enlarged prostate today. And hopefully you feel empowered to reflect on your current lifestyle and try some of these tips out for yourself. You've got nothing to lose and hopefully a whole lot to gain. And of course, if these tips don't work for you, I suggest you schedule an appointment with your GP or urologist, as they can advise specific medications and other medical treatments that might work for you. And that's all I have for you in today's video. Please make sure to subscribe to my channel by clicking the subscribe button below, and comment down below if these 5 tips work for you. And thank you guys for taking the time out of your day to watch my video. I really hope it helped you in some way. And remember to keep going regardless of your situation, and I'll see you in the next video.